Good morning, everybody, and thank you for joining us for Spirit, the stimulating program initiative for retirees that inspires thought. I'm Judy Steinig, Director of Community Programs for the Orthodox Union, and it's my honor to coordinate and host this program. Spirit was started several years ago, first as an on-site program, and now we're happy to present it as an online program for baby boomers, for retirees, for not yet retirees, empty nesters, people in the sandwich generation, and seniors. Everybody who's looking for opportunities for educational, intellectual, and spiritual growth. Since everybody is still sheltering in because of the pandemic, Spirit is the perfect way for everyone to engage in a virtual setting. Today, we are happy to welcome Dr. Shmuel Shields, a certified nutritionist, educator, and clinician who will speak to us on the very important topic of how to boost our immunity, so important right now, and how to boost our immunity with vitamins and minerals. Dr. Shields is the author of L'chaim, 18 Chapters to Live, an inspirational Torah-based book on health with a haskama from Harav Shmuel Kamenetsky. It's my honor to turn the Spirit over to Dr. Shields.
Okay, thank you very much, Rebbe Steinig. I want to welcome all the participants. And I just want to start off by saying very briefly that we are living in very challenging times on a lot of fronts. The particular front I'm referring to is the pandemic, as was just mentioned. And we're also rapidly heading into cold and flu season. It's around the corner. So I feel almost as if we are sandwiched between these two difficult tekufas right now. In any event, I just want to start by thanking the Ribbon Shalom for giving me the opportunity to present today in the hope that I could provide some useful and helpful and constructive information. Bear in mind that I'm not a physician, so I can't take medical questions or things of that nature. And obviously everything that's presented is really for informational and educational purposes. Before you would make any changes in your lifestyle, your diet, or your supplements, you should always talk to a healthcare professional. I would also want to mention that Rebbe Steinig was very helpful to me in preparing for this seminar, so I just want to thank her, and I want to thank the OU and for anybody who's providing technical support for this seminar as well. So the message I would like to get across today is V'nishmartem mi'od l'nafshosechem. You should guard your souls very carefully. The Torah Tamima also learns out from this that it means you should guard your bodies. And I can tell you in the 3 decades that I've been a practicing nutritionist and health educator and health advocate, my hashkafa has always been on prevention. And my book, 18 Chapters, L'chaim, 18 Chapters to Live By, is one that really is a preventive-oriented book. Each chapter is devoted to another aspect of health and teaching us how to stay well and how to prevent illness. Now, having said that, there is some Torah support for this concept of prevention, because we know when we build a new house, we're supposed to build a fence around the roof to prevent people from, falling off. So it's an achrayus that we have to act in a preventive manner in this world. Obviously, there's no guarantees, but we have to do our part. And I want to try to enlighten you a little bit in that area. The topic today is complex and it's detailed, but I tried to make it more practical so we can all get a lot out of it. So even though I know everybody is muted and we can't maybe interact the way we would normally interact in a seminar with questions back and forth and things of that nature, I'm going to do something right now to get everybody involved. I'm going to do something called assessing immunity. I'm going to read off 9 brief questions, and you are going to answer them. And every time you answer yes, make some sort of a mental note of it, or however you want to try to remember what you answer yes to. I think it will be very significant. So the first question I'm going to ask is, do you exercise less than 3 times a week? Do you sleep less than 5 hours a night? Do you drink less than 4 cups of water a day? Do you consume sweets, processed, and refined foods regularly? Sugary foods like candy, cake, cookies, pastries, donuts, muffins, things with a lot of added sugar, things that have been processed, white flour, things of that nature. Do you consume those types of foods regularly? Do you eat red meat and or deli meats 3 or more times a week? And we can even add deep fried foods onto that as well. Deep fried, deli, and red meats 3 or more times a week. Do you eat less than 5 servings of fruits and vegetables a day? Now, the next question I think we're all going to have to answer yes to. Are you under excessive, prolonged stress, chronic stress? Do you use antibiotics frequently? And last but not least, do you consider yourself a pessimist? Now, obviously, everybody's a little bit of both. We have an optimistic side, a pessimistic side. That's just human nature. That's the way we are. But most people can somehow determine which side they're a little bit more to. In other words, if you would ask your neighbor who came home from vacation, how was your trip? And the first thing the neighbor would say is, the food was lousy. So that's tending a little bit more towards the pessimistic side, because if you prompt the neighbor and say, was there anything good about the trip? They would probably tell you, sure, we did great sightseeing, the hotel was beautiful, and the weather was nice. But if you focus on the negative, so that puts you in more of the pessimistic area. Having said that, if you answered yes to any of these questions, that's a little bit of a red flag that could compromise your immunity. So obviously, the more questions you may have answered yes to, the more the immune system could be compromised. And the reason I wanted to start with this kind of assessment is because we are going to primarily focus on vitamins and minerals to boost immunity, but I want everybody to understand that that's only part of the picture. Vitamins and minerals do play an important role, but the immune system is complex. We're complex, and there are many, many factors that could affect immune health. Okay, let's move on a little bit. So right now, I think all of us have part of the story. What is the part of the story that we have? This is the part that we have. Wash your hands frequently. Socially distance. Wear a mask. Cover your mouth if you cough or sneeze, and stay home when you're sick. That's only part of the story. It's a good part of the story, but it's not the whole story. There's a much larger story to tell, and the much larger story to tell is the immune system. It doesn't get much fanfare. It's often cast to the side, and anytime we see information on how to protect or prevent the spread of the virus, or prevent ourselves from getting sick, getting colds, infections, flu, things like that, there's really no information talking about the importance of the immune system. So this is what I want to spend more time on today. The immune system is the body's first line of defense against disease. It's made up of specialized cells, T cells and B cells, and many, many different complex organs and tissues that are involved throughout the body to help protect us. It protects us against invading organisms, microbes, bacteria, viruses, fungal infections, and even against cancer cells, which form in our bodies every day. But Baruch Hashem, if the immune system is doing what it should be doing, those cells get destroyed as well. The immune system has 3 distinct layers. The first layer is physical, our skin. You know what happens when somebody, Rahman al-Islam, has to go to the hospital? Many times they come out with something they didn't go in with. A staph infection is a very common thing in a hospital. Why is that? Because the skin, which is the barrier that protects us against bacteria, many people are ported in the hospital. They have intravenous ports put in. The skin is opened, and we're more susceptible to a bacteria getting in and causing an infection. So the immune system, the skin, the physical barriers is a very important part of the immune system. The epithelial tissue, which lines the digestive tract, and so on, is all part of the immune system. And then we have physical barriers. So let's say there's a break in the skin, a bacteria gets in, white blood cells rush to the scene to try to destroy that bacteria. So we have biochemical barriers, which we refer to as white blood cells, T cells, B cells, and other biochemical components, even things like mucus and body secretions and gastric acid in the stomach can help destroy bacteria in different places in the body. And the last part of the immune system are antibodies, which we're all somewhat familiar with as well. So good immunity relies on good nutritional support. This is the part we're going to talk about today. And adequate vitamin and mineral intake. Everybody here probably has heard of the famous Louis Pasteur, a French biologist. And what did he give us? He gave us the germ theory. The germ theory led to the pasteurization of milk. The theory was that germs are bad for us, bacteria is bad for us, and it has to be killed off. So milk is pasteurized at a certain temperature to kill off the bacteria. That was the germ theory that was developed by Louis Pasteur. Now I'm going to tell you something very interesting that most people don't know. He retracted from that theory somewhat because it's believed that he made the following comment on his deathbed. And this is what he said. I'm quoting, "The microbe is nothing, the terrain is everything." What does that mean? That means don't worry so much about the germs, the bacteria. If the terrain is healthy, if the bacteria is entering a host and that terrain is healthy, there's nothing to worry about. The immune system will take care of it. So his focus at the end of his life was more on the terrain than on the bacteria or the germ. And that's what we're going to be today. We are going to become terrain people. We're going to think more about what we could do to bolster our terrain. And as we're growing older, it becomes a little more challenging, but there are still things that are important that we can all do. Okay, so I just want to tell you something else that I found very fascinating. 175 years approximately after his death, the scientific community of today published scientific studies, peer-reviewed studies from the National Institute of Health. You can go on their website. You can look up some of these studies. I did some of the work for you already today, and I'm going to give you a little synopsis of what these studies talk about. The studies actually support Louis Pasteur's last statement about the terrain, which I found fascinating as a nutritionist. But here's a little summation of what these studies said. If a person has a vitamin or mineral deficiency, even a subtle vitamin or mineral deficiency, there will be a higher infection rate. There will be a greater severity of symptoms, and the recovery time will be longer. They even said there is a basis for low to moderate supplementation to help restore deficiencies. Again, the emphasis here, and this is something that I've said all along as a nutritionist, is that many people make the mistake of sometimes taking too many supplements. Too much of a good thing is not a good thing. I'll just diverge for a second and tell you a story about a patient I had many years ago. I tell all my patients when they come, bring your supplements. Not your medicines. You'll tell me your medicines, but I want you to bring your supplements. I want to see what you're taking. Because a lot of times people forget or they don't remember. So one day, a patient walked into my office with a suitcase. I said, "Where are you going, Florida?" He said, "No, he told me to bring my supplements. They're all in the suitcase here." So I said, "Open it up." He opened it up. I counted 40 bottles, 40 bottles of supplements in the suitcase. So my first question to him was, how long does it take you to take these supplements every day? He told me he spends 20 minutes a day swallowing those pills in the morning or whatever he did it. And then I said, "Where did you get all these from and why are you taking so many supplements?" He said to me, "Every time I read something in the newspaper or a magazine about a supplement that's good for you, they tell you it's good for you, I go out and get it." I said, "I can't believe it." And then he tells me, after I did more of an evaluation, he tells me, "You know something? I get very frequent nosebleeds." I said, "Really?" I said, "Let me take a closer look at some of those supplements you're taking." So he was taking a green tea extract, a large dose of vitamin E, an herb called ginkgo biloba. His doctor also had him on a baby aspirin, and he was taking some garlic supplements. And I said, "You know something? All of those things that I just saw, they all thin the blood." Now, having the blood a little thinner isn't a bad thing. He was also taking a fish oil capsule, which is fine. That also thins the blood. But he was taking so much, and the baby aspirin thins the blood. He was taking so much of the same things that thin the blood, he caused a problem for himself. So I just want you to know that if supplements are used wisely and prudently, they can play a big role in restoring immune health. So I'm just trying to tell you to be cautious, speak to a nutritionist, speak to a healthcare professional. I consult with people all the time on these matters. I have a chapter in my book about vitamin and mineral supplements, what to look for, how to supplement sensibly. But it's an important thing, and I just want you to be aware of that as well. Supplements can also interact with medications, with different foods. So you have to be a little cautious. That's all I'm saying on that. Okay, so what I'd like to do now, since we covered a little bit the immune system in a very brief way, I'm going to ask if Rebbetzin Steinig could share the screen, and we're going to put up something called 10 immune boosting tips for you to look at. Okay, 10 immune boosting tips.
Can you see it or you can't see it yet?
Can't see it yet, no.
Wait, 10 immune?
Yeah, 10 immune boosting tips. Okay.
You have it now?
There we go. Okay, we just
Okay.
need to, yeah, okay.
Okay, wait, I'll bring it down.
Okay. Okay, beautiful. Okay.
Okay? You
Okay,
can't
that's
see
good.
it.
Okay, so let's take a quick look, everybody, at these 10 immune boosting tips. And by the way, as one of the pieces of material that will be sent to you after this seminar, you will be getting not these 10, you will be getting 10 immune boosting tips, but they'll be more elaborate with more information with each one. I'm just going to touch on each one briefly now, just to give you a feel of things that could boost immunity. Correct nutrient deficiencies. If there are any vitamin and mineral deficiencies. The best way to cover nutritional gaps where we could be missing some things, and we are, we'll talk about that a little later, is to make sure we're choosing whole foods and then supplements where they play a role. So we see, eat nutrient-dense foods. That's the next point. Instead of calorie-dense foods, meaning foods with a lot of calories, let's eat foods with less calories but more nutrition, things like fruits or vegetables or fish or things of that nature. Spice it up. Things like curcumin, curry, ginger, raw ginger, garlic, thyme, oregano. These have some immune boosting and antiviral properties. So using some healthy spices on some of the foods could be an interesting way to bolster immunity. Very important to stay hydrated. You saw one of the questions I asked you earlier, staying hydrated, because the immune system needs water to move on. Think of a boat floating. If you don't have enough water for that boat, it gets stuck on the bottom there. It can't move. It's going to bounce around or drag on the bottom. Those cells travel through the rivers that we have in the body, and we need to stay hydrated. We'll talk about that a little bit more in an upcoming slide as well. Exercise. Now, interesting to note that intensive, prolonged exercise could work against immunity, but moderate exercise can bolster immunity. Again, speak to somebody about maybe getting a good program together for your needs. Fresh air and sunshine. I know a lot of people have been homebound, but try to take some time every day to get some fresh air and sunshine. It's an immune booster, and it's a mood elevator. And we're going to see very soon that mood affects immunity as well. Sleep, okay, we all need more of it, but try not to fall below 6 hours a night. If you have trouble sleeping, I have a sleep disorder, it should be evaluated and treated properly and so on. Psychoimmunology. This is the Rambam. The Rambam, 800 years ago, told doctors that make sure your patients have a cheerful frame of mind, because if they're depressed or they're down, it's going to affect their well-being and their immunity and so on. And this is a new field of science today, but we already learned it from the Rambam 800 years ago. Again, science is just catching up with the Rambam 800 years later, that's all. And relax. The best way I can tell you to relax is go for a walk without your cell phone. Okay, those are those tips there, so we can close the screen now. Okay, and while we're on the immune system, let's take a look at one more slide. If we could just share the screen again for immune boosting foods. Immune boosting foods.
Wait, 1 second.
Okay.
You can start talking. It'll take me a minute to get it up.
Okay, so you're going to see a list of foods that research has shown play some role in bolstering the immune system. Obviously, it's not an exhaustive list. You know, there are many, many other foods that are healthy and good and we should use, but when you see the list here of the immune boosting foods, you may want to make a mental note. Do I get these things in once in a while, every day? Or there's some that maybe is safe for me to try? And I think, okay, I basically feel that foods are very important for us because we can't get from a pill what we can get from foods. The Rebbeinu Shalom put into food hundreds, thousands of different chemicals, phytonutrients, vitamins and minerals that work synergistically together. And we want the food has to be the base, and that's where we have to get these things from. So let's take a quick look at some of these foods. Beta carotene and zinc-rich foods. Beta carotene are the orange foods, carrots and sweet potatoes and cantaloupe and things of that nature. That's a source of vitamin A. That's something that many people are deficient in, and that's something that's important for the immune system. It's important for the health of the skin. Okay? Green tea, we all have heard a lot about green tea, drinking maybe some organic green tea, a couple of cups a day after you get in enough water. There are some very interesting things in green tea. There is a certain amino acid in green tea called L-theanine, which contributes to its immune boosting abilities. Come back to the top for a second. Zinc-rich foods. Zinc is a critical mineral for immune health. We're going to talk more about it in a second. And basically, it's found in foods, but as we get older, we may not absorb it quite as well. So some supplemental zinc may be important. But again, not to go overboard. Let somebody help you with that. But some of the zinc-rich foods are things like chicken, turkey, beans, lentils, chickpeas, nuts, whole grains, and wheat germ. Zinc decreases the risk of infection and helps in the development of white blood cells and wound healing. So very important. Mushrooms have been heavily researched in countries like Japan, where they use mushroom therapy for cancer patients. It's used for immune boosting benefits and so on. So again, they are involved in the productivity and activity of the white blood cells. When it comes to fish, the omega-3 fats are very important for the immune system. Many people are deficient in omega-3. Omega-3 essential fatty acids reduce inflammation, they increase airflow, protect the lungs from colds and respiratory infection. So omega-3 fats are very important. Okay, then we have oats and barley. Oats and barley contain a certain type of fiber called beta-glucan, and they discovered that it has antimicrobial properties and it has antioxidant properties, and it boosts immunity. So this is something to keep in mind as well. Chicken soup. I know you were waiting for that one. It's not an old wives' tale. Chicken soup really has benefits. It has something like antibiotic properties. Now, and it soothes the sinuses. And they say you benefit if you have maybe a few cups a day. If you feel a cold coming on and you don't feel that well, a few cups spread out throughout the day of chicken soup could be beneficial. But again, if a person has a serious bacterial infection, I don't think it's the mitzias to rely on chicken soup to treat it. If a person has bronchitis or pneumonia, you're probably going to have to take antibiotics, but the chicken soup could certainly be helpful. Okay, garlic, raw garlic or garlic supplements, again, have a long traditional herbal history of being good for immunity and antibacterial and antiviral and things of that nature. And then colorful fruits and vegetables, again, for the antioxidants and for the vitamins and minerals that they give us, very, very important. And then many of you probably heard about probiotics, the healthy bacteria that lines the gut. A lot of the immune system is in the gut. And these live cultures found in things like yogurt, kefir, soy-based products, which many people are not that familiar with, but things like tempeh, which is a fermented soy product, miso soup, natto, and naturally fermented sauerkraut. That's probably more of a health food store item. Okay, I think that's the end of that slide there. So I think we could close the screen sharing on that one. And we'll go a little bit further. Okay, so now what I'd like to do is I want to tell you a little bit more specifically how vitamin and mineral shortages harm the immune system or harm immunity. So by a show of hands, are there any bakers in the audience? Anybody bakes? Okay, I see a couple of hands up there, great. So listen to this. Let's say you want to bake a pie and you get together and you need 7 ingredients for that pie. And you go through your kitchen and through your cupboards, and lo and behold, it happens all the time. You only come up with 6 out of these 7 ingredients. Can you still get a pie? Most likely, yes. Will the taste, the texture, and the aroma be compromised? Probably so, because you missed an ingredient. For human nutrition. So let's say you take good care of yourself, you're a good eater, and you take that 1-a-day multivitamin, and then all of a sudden you get 39 out of the 40. You get 39 out of the 40. So you might say, not bad, not bad. Imagine if you were a professional ball player and you got up 40 times and you were on base 39 out of the 40 times, you'd have a tremendous contract. You'd be the most famous ball player in the world. But when it comes to nutrition, it's not good. Because if you're missing iron, you're going to become anemic. If you're missing calcium, the bones are going to become more brittle and more prone to fracture. Every nutrient, every vitamin mineral out of the 40 that you could become deficient in and be deficient for a long enough period of time leads to some illness or some problem, and so on. Right now, we're going to focus more on the immune system, but I just want you to be aware of that. So let's say a person is low in vitamin D. D is in David. I'm willing to bet that 50 to 80% of the people in attendance today have had their blood checked, hopefully, or if they haven't, they should, and found that their vitamin D levels are low. It's a very, very common deficiency. And I want to tell you something. Low vitamin D levels impairs calcium absorption. It doesn't matter how much calcium supplements you're taking, how many calcium-rich foods you're eating. Without enough vitamin D, it doesn't get absorbed well. It leads to weaker bones. It could lead to joint pain, poor muscle tone and balance, and an increased risk for diabetes, heart disease, cancer, autoimmune diseases, infections, colds, and flu. So it behooves us to have your vitamin D level checked. If it's low, it's not a difficult or painful thing to correct. With the right supplemental dose, taken either every day or once a week, you can get yourself into the range. The range starts at 30, it goes to 100. Some experts think being in the 40 to 60 area is more optimal for the immune system, but let your doctor could talk to you about that. If your zinc is low, out of those 40 nutrients, your zinc is low, it could cause reduced production of lymphocytes. It can cause something called oxidative stress, inflammation, and it can increase the risk for all types of infection, including bacterial, viral, and fungal infections in the body. So making sure we incorporate some zinc-rich foods and possibly looking into some zinc supplementation. But again, modest amounts of supplementation is what's important. There are times when you might need much larger amounts of supplementation or even mega doses of certain nutrients, but that should only be done with the guidance of a healthcare professional, okay? Because some of these things could become toxic at high dosages, or there could be other potential problems. Okay, so let's talk a little bit more about vitamin and mineral deficiencies. And we have something called malnutrition, which we usually think of third world countries not having the staple foods they need, and people suffering from malnutrition. And in the industrialized countries, we have a term that I think has been phrased by Consumer Reports on Health called undernutrition. In other words, we are missing some of the key nutrients. Surveys show that people fall short on certain nutrients. 35% of people 50 and over are known to have deficiencies in either one or more nutrients, meaning either vitamins or minerals. So it is somewhat common to have deficiencies. I want to talk to you about why that is, and maybe that will give you some insight on how some of those things could be corrected. So let's see if we could, before we screen share, I'm just going to give Rebitz and Steinig a little time to find the next slide. It's going to be nutrition lost in the refining process of whole wheat. Oh, wow, look at that. Okay, very speedy there. Okay, thank you. So let's take a look at this for a second. Nutrients lost in the refining process of whole wheat. Now you have a series of vitamins and minerals there. The green are the minerals and the blue are the vitamins. And I highlighted the colors that are important for immune health there, okay? So let's take a look. Let's focus on the colored ones. Iron. Iron is a trace mineral, a very, very important mineral. Men have to be a little careful because some people accumulate iron in the body, so you don't want to get too much. But 84% of the iron is lost in the processing or refining of whole wheat bread. That's what we're talking about here. What is lost when whole wheat bread is refined? Copper, another mineral that works together with zinc, 75% lost in processing. Vitamin B2, 70% lost. Folic acid, these are all important for immune health, 70% lost. Zinc, 64% lost in the processing and the refining of whole wheat. Vitamin B6, 60%. Again, the highlighted ones there in color are all ones that are important for immune health. Okay, so again, we can close the screen sharing now. Thank you for that. Now, I just want to let you know something about processing foods. The processing of our foods in the 1900s, at the turn of the century, only 10% of the food supply was processed. Today, 90% of our foods are processed. So it's not a tremendous mystery why we could be falling short in nutrients if we're not being careful with the food choices we make. I want to talk a little bit about sugar consumption and how that could cause nutrient deficiencies. In the 1600s, when the Pilgrims first came to this country, the average person back then was consuming about 7 pounds of sugar annually, 7 pounds a year. That's about enough sugar to bake 25 apple pies with. Today, I want everybody to hold on to your seats, brace yourself a little bit. The average person in the United States today consumes somewhere between 125 to 150 pounds of sugar annually. So if I had an 8-ounce cup in front of me and I filled it 3/4 of the way with sugar, you'd have to be taking in that much sugar every day to reach those numbers. And we are, many people are. In my practice, I do a very thorough nutritional evaluation. I do an intake, and people will tell me, I don't use sugar. I say, what do you mean by that? They say, I don't put sugar in my coffee, in my tea, in my cereal. I said, really? I said, do you have yogurt for breakfast, a fruit-flavored yogurt? I said, yeah, I have that sometimes, sure. Look on the container, 28 grams of sugar. Every 4 grams equals a teaspoon. That's what, 7 grams of, that's 7 teaspoons of sugar right there in the yogurt. I said, what about orange juice? You drink orange juice in the morning? Of course I do. You can't have breakfast without orange juice. What do you? I say, really? Okay, fine. Another 28 to 30 grams of sugar in the orange juice, even if it says no sugar added. Think about it. You want to make yourself fresh orange juice, you got to squeeze 6 or 7 oranges. You get a tall glass of orange juice. When you drink that, you get the sugar that's in 6 or 7 oranges. Eat 1 orange. The juice is loaded with sugar. And then, I don't have to tell you, you go to the supermarket, anything in a box, a bag, a can, a package, look on the label, you're going to find sugar. So the more our diets are filled with sugary foods, these sugary foods don't have much nutritional value to begin with. So where are the vitamins and minerals going to come from? If we're loading up every time we have a snack or a meal or whatever, and we're using either refined foods or processed foods or foods with a high sugar content, there's not going to be room for the essential nutrients that we need. They're going to be pushed out from all these other things that we're having. Okay, so what else causes nutritional deficiencies or undernutrition? Animals are raised on the wrong diets. Cows, everybody knows the natural diet of a cow, it's grass, green grass. Most of the cows are raised commercially on cornmeal. Cornmeal is not a source of iron, green grass is. So when you eat the meat of a cow raised on green grass, you're going to get more iron, probably more zinc, probably more vitamins and minerals and things, and less fat. And you can get this meat today. There's meats called natural pasture. There's organic meats. So these things are available. These are a little bit better quality, and even then you want to be moderate, but it would probably be a better choice. But that's why, and I'll even tell you something else very interesting. Greens are also a source of omega-3. Not as much as fish, but they contain a little omega-3. So when a cow is given green grass to eat, that meat will even contain a little omega-3 fatty acid to it. Okay, other reasons why we might suffer from undernutrition is decreased appetite and lower calorie intake. We're going to talk about that on the last slide. And then, of course, there are always unfortunately, diseases of the digestive tract, Crohn's disease, colitis, IBS, and so on, that can cause malabsorption of nutrients and so on. So when I work with patients that have any of these kind of digestive issues, I make sure that we work on a good meal plan, a supplement plan, and things that can bolster what I feel they could be having problems with. Okay, I think we're going to conclude with one last, it's actually the last slide. Okay, terrific. It's called Nutritional Challenges of Growing Older. Okay, so here they are. We require less calories as we get older because we're not as active. We don't need the same amount of energy, the same amount of caloric energy that's in calorically dense foods. So we can get by on less calories. Also, as we age, our appetite isn't quite the same. We don't need to eat as much. But here comes the catch-22. We still need to have the same amount of nutrients as a younger person. The vitamin and mineral needs that we have hasn't changed. And in some cases, a person who's older may require even more of certain nutrients, certain vitamins and minerals. Okay, another challenge is brain receptor changes. Our thirst and hunger mechanism changes. Sometimes we don't feel thirsty, so we're not drinking, or we don't really feel hunger so much, so we're really skipping meals and not eating. So I'm going to go through them quickly, then I'm going to come back with maybe some practical suggestions. Lower intake of antioxidants because of maybe a lot of refined foods and not eating as much and so on. Vitamin D, B12, and zinc deficiencies. The reason these are here is because these are a little bit harder to correct with food alone. Vitamin D, if you're deficient, it's virtually impossible to correct with food alone. You're probably going to need supplementation. B12, as we get older, we produce less gastric acid in the stomach. That's hydrochloric acid, which is needed to extract B12 from food. So even though you're all probably eating a lot of vitamin B12 rich foods, it doesn't mean you're absorbing it. And that's why I urge you to have your B12 level checked, your vitamin D level checked. And if you want, you could even ask your doctor to do a full vitamin and mineral profile where they'll check all the vitamins and minerals. Zinc deficiency, as I mentioned, a little bit harder with absorption as we get older. So even though we have zinc-rich foods, we could be falling a little bit short there, which may require some supplementation. Hormonal changes for taste and smell. Sometimes the sense of taste and smell changes. Swallowing issues. The food tube gets a little narrower and it becomes a little bit harder to swallow. Dental issues, gum and teeth problems and things of that nature makes it harder to chew. And then muscle atrophy. It's very common for muscles to atrophy as we get older. It's called sarcopenia. And constipation could also be a problem with aging. And anyway, just to briefly touch on these things to give you some ideas. And again, a lot of these things you're just seeing are addressed in my book, L'chaim, 18 Chapters to Live By. I talk about these things, many things in more detail, and it's a very easy book to read, an easy book to follow. And if you want to have healthy children and grandchildren, maybe get a copy for them because this information isn't so readily available. Anyway, if we don't feel like eating as much, so have smaller meals and snacks throughout the day. You don't have to sit down to huge meals like maybe you're accustomed to. Smaller meals and snacks are fine. Try to drink even if you don't feel that thirsty. We need approximately 8 ounces of water for every 20 pounds of body weight. Okay, 8 ounce cup of water for every 20 pounds. So if you're 100 pounds, you need about 5 cups. If you're 200 pounds, you need 10 8-ounce cups. You do get some water from other beverages, from things like soups and coffee and tea and things of that nature. And you even get some water from your foods. If you're eating fruits and vegetables, there's water in there. You could probably get a cup or 2 from your foods if you're choosing the right kind of foods. But water is very important for the immune system and so on. Lower intakes of antioxidants. You try to keep your diet. In my book, I talk about rainbow nutrition, the value of different colored foods, the kind of nutrients, vitamins, antioxidants you get from those. You try to keep your diet colorful to get more antioxidants. If you're taking a multivitamin mineral supplement, you have some antioxidants there as well. Okay, hormonal changes for taste and smell. Again, you may want to season your foods. We mentioned some immune boosting spices earlier that make your foods taste better and may feel like eating them a little bit more. For swallowing issues and dental issues, I would recommend, and I do this with my patients all the time, I teach them how to make nutritionally fortified smoothies. There's a lot of things that can be added to bolster the nutritional value of a smoothie or a shake. Soups are a great way to get good nutrition. There are some soups that you can buy even in the supermarket that are made very well. There are companies that make organic soups, and you can get reduced sodium soups. You can make your own homemade soups, but there are ways for people that have swallowing issues and dental issues to not compromise on good nutrition because of those issues, but by meeting with a nutritionist, consulting with a dietitian, you can come up with a plan that I think could be very valuable and helpful. In terms of constipation, obviously fiber and a good water intake would be a basic place to start, but certainly if it's a symptom you're concerned about, it should be discussed with your doctor. Okay, that basically concludes the presentation. I just want to say that I am available as a consultant, and I am available as a speaker, and if I could be of a resource to you in any way, please don't hesitate to contact me. You will get contact information, and if there are any organizations you're part of that would want a Zoom presentation, you can contact me as well. Anyway, it was really enjoyable to be here today. I hope I got a message across that will be helpful to you. You will be getting something sent that will provide more detailed information. And once again, I want to thank you all for participating. I don't know if there's maybe we could take 5 minutes of questions if there are any.
Okay, I want to thank Dr. Schultz so much, but before we conclude, I actually do have a few questions. So the first one is, do you have any thoughts on melatonin? I'll ask you one at a time. So do you have any?
Okay. So I know, first of all, melatonin is a hormone. And I would say, as far as I know, I think it's reasonably safe to use. However, if you do have any underlying medical condition or you are on medication, you have to check with your pharmacist or your doctor to see if it's appropriate for you. There are people that it does benefit. And I've had patients that have used, they start off with a small amount, whatever, and some people it works for, some people it doesn't. No two people are exactly alike, but if it's safe for you to use, and you feel you want to try it, I don't think it's a problem trying it.
Okay. Next one. During this time of COVID, are there any specific immune boosting differences? Should there be higher vitamin D3, C, things like that? Also with that is the question, which do you feel is absorbed better, liquid D or capsules?
Okay, great question. I don't know here's the way I would answer the question. For sure, if you're deficient, if it could be demonstrated that you do have a deficiency, then correcting the deficiency would be the best way to take care of boosting your immunity during cold and flu season and the pandemic and so on. However, if there's no vitamin D deficiency or no vitamin C deficiency, if taking a lot more would be beneficial, that's an area of controversy. And there are many experts that think that going way beyond what you might need, if your needs are met, may not make a difference. Will probably not make a difference and possibly could have a side effect in other ways. For example, we know that zinc is very important, but if you load up on too much zinc, it suppresses the absorption of copper. Copper won't be well absorbed, and that's needed for immunity also. Also, folic acid and B12 play a role in the immune system. if you take too much folic acid, it will mask a B12 deficiency. You won't know you have a B12 deficiency, and that's not good either. So keep in mind, many of us do eat fortified foods. You could pick up a box of breakfast cereal and see that it has 100% of your folic acid, your recommended daily amount for folic acid. In addition to that, you're getting a dietary source from other foods that you eat during the day of folic acid. Your multivitamin supplement has folic acid, and before you know it, you could be getting too much. So, so this is my concern. So I would rather err on the side of caution. I'd rather you work as much as you can with your foods. Moderate or modest supplementation, I think, could be helpful if you feel you're falling short. And I would say certainly get your vitamin D level checked. If you're just barely in the range, like you're 30, and some experts feel that 40 to 60 could be a better range, you can discuss with your doctor or your healthcare professional about taking maybe some extra vitamin D just to get a little bit higher into that range.
Okay, we have a couple more questions.
Go ahead.
Okay, first of all, so somebody wants to know about taking multivitamins. So you actually just mentioned them, so I guess that's not a
right. I think here's where it gets a little tricky. Not all multivitamins are the same. Some are made a lot better than others in terms of quality, and formulations become very important too. Many of the formulas could be out of balance. I would say to play it safe, you want to get if you do decide to use a multivitamin mineral supplement, you want to get something that doesn't really exceed the recommended daily amounts, unless you know there's reason why you need more of a certain nutrient. Even with vitamin C, on some of those types of vitamins, you could go a little bit higher, but I don't think it's, I think the 200 to 400 milligrams, the Linus Pauling Institute feels that is enough. That's adequate to saturate body tissue. And if you go way beyond that, I think it will just be excreted, and I don't know how beneficial it will be. I know that there could be a therapeutic benefit intravenously for certain illnesses, but that's not really the scope here.
Okay, I think we
mentioned one other thing
before on liquid or capsules for D3. Is there a difference?
Right. Okay, so I could just tell you, just to backtrack a little bit, I do have a chapter in the book that will give you some guidelines on how to choose a better supplement. So that might be helpful to you, certain things to look for, and it's a little bit more detailed than what I can tell you now. As far as liquid and capsules tend to be maybe a little bit better absorbable than a tablet, but if the tablet, again, is made properly so it will disperse properly in the gut, it should absorb also well. What you could do with the vitamin D, whatever format you're using, liquid or capsule or tablet, keep track of the amount that you take, and maybe have your D level checked, and the doctor could determine. You could say, look, I've been taking 2,000 IUs in this form the last 4 or 5 months or 6 months, and the doctor will be able to tell you where you are in the range. And if it's not working, then maybe you'll take more or whatever. Okay.
Okay, we have a couple more questions. We can get. Okay. Turmeric, is that something people should take? There's some people have been hearing negative comments about it. Is that something important, or they shouldn't take?
Okay, good question. Again, I'm not an expert on all the herbs out there, but the active ingredient in turmeric is curcumin. That's what gives it that beautiful yellow, orangey kind of color. I would say that I would check into that a little bit before. I don't know if it's used as a seasoning on foods or with foods. I would imagine that if there aren't any health problems that it would be a problem for, it could be used. I would say maybe in supplement form where it might be more concentrated, or you might be getting too large of a dose, maybe in that form it might be a little bit more tricky to do. I personally, occasionally I do use it for cooking. They say if you use a little bit of oil with it when you're cooking and you add a little curry is almost the same thing, but the orange color that you see in curry comes from turmeric, the curcumin, which gives it that orange color. And I use a little oil and a little bit of pepper, which they say makes it a little bit more absorbable. But it does seem to have some very good benefits to it.
Are there any advantages to taking biotin?
Not if you're not deficient, okay? And biotin, most people are not known to be deficient in biotin. It's found in many of the foods that we eat. If some comes in your multivitamins mineral supplement, I don't think that's any problem at all. But whether you really need to invest in large dosages of biotin when it may not be necessary, I don't know if you have to do that.
Okay, last question. Do you have a comment about vitamin-enriched bread or milk?
Vitamin-enriched what?
Bread or milk?
Oh, bread or milk. Vitamin-enriched usually means that they're fortified with vitamins and minerals. Unfortunately, many nutrients are lost in the refining, and sometimes they put back a few synthetic ones, and they're able to call it enriched. I would say the best bet is to stick with foods that are made of whole foods. You can use foods that are fortified. There's not really a problem doing that. But in addition to that, try to choose more whole foods in your diet. This way you'll benefit from the vitamins and minerals that are in those foods, as well as the antioxidants and the other components that come along with the food. In other words, if you eat fish and you get the fish oil from the fish, it's a better way to get it than taking a fish oil capsule. But if you're not eating fish and you feel you would benefit from some extra fish oil, it could be gotten from a capsule, but the fish would be always going back to the food source would be better. If you need larger amounts of it for a medical reason or for a deficiency, then you might have to go to a capsule, okay? But that has to be determined by working along with a physician and a nutritionist to try to guide you through a very complex process, because there are factors of age, factors of health, factors of medicine that could all interfere or affect, have an interaction with supplements as well.
Okay. I want to thank Dr. Schild so much for all the wonderful information that he gave us, all of these immune boosting tips, and hopefully we will begin to take them. So now today's recording, as you all know, or anybody who is not new will know that with God's help later this afternoon, you will all get a copy of the recording. You don't have to ask me for it. Anyone who registers for any program, whether they're on here or not, we have Baruch Hashem people that are still working. We have people all over the world. So as long as they have registered for the program, they automatically receive it from my email later on today. It will come with the PDF of the 10 immune boosting tips, right? But more comprehensive than what was showed on that slide. Dr. Shields gave us some more information in it with his contact information if you would like to consult with him, and the name of his book if you'd like to order it. Doctor, is that available on Amazon?
No, it's only available through me.
Okay, so if you want to get the book, you will speak to Dr. Shields. His information, his bio and information will all be on this PDF that'll be attached to your email this afternoon. So what else? A few other points. With God's help, next week we'll be having presentations both on safety and strategies to improve our mental and physical health. That's of course Tuesday and Thursday. Stay tuned for emails that will give you that information. Again, we want to thank all of our partnering synagogues throughout the United States that help us spread the word on this program. As I said before, since people are in so many different areas, it is very possible that someone in California is not going to be up at 8 o'clock in the morning to watch this program, which for us on the East Coast is at 11. Not to worry, because as long as you register, as I said before, you will get the recording later on. We're happy to have people watch it in any which way. And as I also mentioned before, we're also very excited that our archives, our Spirit archives, are finally available. They're usually, at this point, they won't have this week's programs on it, but they are current through last Thursday's program. So we're going to try to keep up that as much as we can with our web department. But anybody can get those recordings from, I think we started archiving at the end of March. So just you have to go into the archives. I give you the link for that in all of the emails, and then you have to give a little bit of information, and then they're available for you. I think that is about it. As I said, watch your emails for the registration. But again, I do want to mention that because of Zoom security, everyone has to register for every program separately. That includes me. Every single person. Dr. Shields had to register. It's just the way it works. It keeps our program safe, and it actually helps us to grow our programs because once we have your email addresses, if you sign up once, you will always get an invitation to the next program. So I guess that's about it. I want to thank everybody so much for joining us. Again, thank you to Dr. Shmuel Shields for spending so much time with us.
No
Have a great day.
Can I
Have
make
a
a
good
closing?
Shabbos. Be safe and healthy.
Can I make a closing comment? One quick closing comment?
Absolutely, yes.
Okay, so I happen to be a Kohen, so I'm allowed to give brachas. So the bracha I want to give to all the participants is that we should stay safe and well. We should be gesund. We should have a safe and healthy winter season, and we should get through this all together. Thank you.
Amen. Amen. Thank you so much.
Okay.